Hi, my name is Dr. Ronald Nicholson,
And this is Dr. Steven Phillipson.
and we are going to continue to talk to you today about OCD and the Choice article and how you can better take care of your own mental health. Doctor.
So the thought I had for our discussion today is about the things in school that they never taught us that could have saved many people a lot of mental anguish, a lot of unnecessary mental anguish. And it would actually be a really good prelude for if and when people develop OCD, how to understand kind of the brain's functioning. What's very much not discussed in school is the idea that the brain, as a machine, will often send us information that it believes in some way may be beneficial, but sometimes the brain sends us information that's just basically random associations that it, for some reason, has a sense of attachment to or potential significance. And growing up, I'm not sure about you, but my brain used to produce all kinds of kind of dark associations. It used to tell me to harm my dog, even though my dog was the most lovable thing in the world for me. And I thought, what clear evidence that I'm a horrible, evil person, because here I'm having thoughts about harming the most precious thing in my life.
Right.
And I didn't know at the time, no one was teaching me in school, and my mom, even though she was in psychology, she didn't teach me that our brain sometimes produces associations that are kind of potentially violent or negative or dark, and that these associations are a complete disconnect from our identity, our values, our own sense of priority. And it's just the brain testing ideas.
Right. That's something that I have to cover with my patients all the time, is the idea that the brain is going to send you stuff, and that doesn't necessarily mean anything. People come into therapy wondering, I had this thought, what does that mean about me? Or often if you have OCD, a very common thing is going to be, I had this thought, that must mean something, right? And we have to say to people all the time, which is, no.
So it's not that the brain voice is this malevolent entity in our life. It's just a kind of a machine that has no ethics or principles. It's
Right.
just a thought generator,
Right.
and it doesn't really scrutinize its own material.
Right. It's always testing new combinations of things. What works, what doesn't? Is this relevant? Is this not relevant?
Is it meaningful?
It's just sending you random material throughout your day. And the problem that we're kind of getting at is people aren't really taught that. They come to us in therapy wondering, what does this mean about me? Is this a sign of a problem? And we have to say, this is just random stuff.
I think the important thing is to understand that what differentiates people who have OCD from those who don't, it's not the thought content.
Right.
Many people with
Right.
OCD, they think one of the therapeutic goals is for the thoughts to go
Right.
away. And what they don't recognize is that it's unreasonable to try to modify your brain to behaving in a way that's not natural to the human condition. All humans throughout their life will tend to have these negative, these dark associations. The foundation of OCD is the anxiety component.
Right.
So when non-anxious people have these same intrusive thoughts as people with OCD, they just sort of have a second or two of the heebie-jeebies and then kind of move beyond it and think, oh boy, that was crazy. And then they just kind of go on with their life.
So we need to give permission to our brains to have whatever thoughts that they are. And the big thing that we walk away, as therapists, we wish that we had learned this earlier in life, and we end up saying this to our patients pretty early on in the treatment process regularly, is your brain is just a random thought generator. And that's okay. All that matters is what you choose is relevant versus not, and then what you choose to act on. Sound good?
Sounds amazing.
Excellent.